I've made the choice not to see my family just for the duration of this pandemic. I've made the choice not to see my friends.
Every healthcare practitioner probably does worry about contracting the virus. We're just travelling out to a halting site. We have 13 people to see there to do testing for. Their caravans are very close to each other. They're all in a congregated setting, so self-isolating here is going to be very difficult. So it's important to get them tested, get the results, and as an advocacy piece, I think it is very important to be here. A very high proportion of the Roma community are testing positive, which is hugely concerning. They are mostly living in congregated settings.
So tell me, what are still now your symptoms today?
Yeah.
Can you tell me you started
What we find difficult, or more difficult about it, is, we can find it quite hard to make contact with patients. Anyone that we're trying to follow up on the monitoring and assessment team, they might not have phones, there might be language barriers, we have to use translator services, and I suppose it makes everything that bit more difficult than it usually would be.
So we're just after doing 12 tests for symptomatic people in this site, and we're just finishing up here. So what we're going to do is contact. I think it's a lot to get your head around, but I'm thankful to be working. Thankful to be a healthcare worker where you can provide services in this pandemic.
I think every health worker is scared that they'll pick up COVID-19 themselves, or that they'll bring it home. But I think it's, as a health worker, I think you're faced with this. No one ever expects to have to work through a pandemic, but I think when the time comes, you need to be able to step up and do what needs to be done.